There's a new warning to baby boomers. Aged care could be hard to find in their golden years. That's the blunt assessment of a coalition of aged care organisations. They say demand will double over the next 20 years, and successive federal governments have failed to plan for it.
It's an accommodation crisis that's already dire, and many of these residents at St Anne's Aged Care Facility in Hobart consider themselves lucky to have found a place.
I've only been here 5 months, but I've settled in wonderfully well because it's a home away from home. That's what I feel.
A Productivity Commission report into the sector last year found that the problem is set to become much worse, and that by 2050, 1/4 of Australia's population will require aged care services. It called for a widespread overhaul of the aged care system to improve services, choice and pricing for consumers and address workforce shortages caused by low wages. The situation is especially bad in Tasmania and South Australia, which have a high proportion of older Australians.
We are now, in Tasmania in particular, because of our ageing demographic, more under siege, more under pressure than we've ever been before.
But pressures also exist throughout the country, with high waiting lists along the eastern states and difficulty finding staff in places like Western Australia.
If the system isn't working today, it's not going to be able to cope with the increased numbers.
A National Aged Care Alliance representing 28 health, medical and charity organisations is calling for the federal government to act in the forthcoming federal budget.
And if we don't commit to the roadmap right now, we're going to find that every year we don't commit is going to be harder and harder to actually achieve the end goal.
A spokeswoman for the Minister for Ageing, Mark Butler, says the government won't respond to the Alliance's claims, but is working on a response to the Productivity Commission's report. Paul Clarick, ABC News.